What's going on, everyone? Welcome to today's pandemic update for Friday, May 5th, 2023. As you can see, we're still masking in these videos, and we're going to continue probably into next week. I'm still feeling absolutely fine. I'm tested negative again today, and that is some really good news. And yes, we're just going to take it day by day. As you may have known, there is a COVID positive case in the house, but I will give you some good news that they seem to be doing better now for the most part, and their biggest issue now is just very tired. They get tired very easily. So that's all I can tell you about that. Moving on to India today. India adds another 3,611 new cases, and their deaths are up to 36 today. So I believe it was last Friday they recorded 40 deaths. Today it's only 36, so even their deaths are starting to decline, but any death is one death too many. Alrighty, now we have some big news. We have two big bombshell news stories to report on to you. First off, this one. WHO declares a COVID global health emergency? This is the World Health Organization. So basically, they had their meeting yesterday. Remember, I was telling you, this is their 15th meeting as to declare whether or not COVID-19 is still a pandemic emergency. And guess what? They declared that it is no longer a global emergency. In other words, COVID is no longer emergency, and I believe the pandemic status is going to be changing pretty soon as well. Eventually, they're probably going to call it an endemic. Now, we know we can't eradicate COVID. We know that we're beyond the point of doing that. But the problem is, if you saw my previous video before this, all these new variants that keep popping up, any one of them could end up being more severe, or a future variant that pops up. It is only a matter of time till a more severe variant pops up, and until we can solve the issue of these new variants forming that have different aspects in the spike protein, or any aspect of the variant is different, and it could undermine all the progress we made, the treatments, the vaccine, and that's a problem. And that's something that, in my opinion, is still urgent and still calls for this to be a pandemic emergency. Also, the United States had close to 1,400 deaths last week. That's still quite a few deaths. There's still a lot of deaths happening around the world. Not all the deaths are being counted properly as COVID because, as you know, testing is just so horrible now. So there's so many different issues and reasons why this should change. Moving on to our next bombshell news story today. If that wasn't enough, it gets even more interesting. Lewinsky, Rochelle Lewinsky, is leaving her post as CDC director. So essentially, she is stepping down from the CDC. And quite frankly, this could be a whole video within itself. We're not going to spend the rest of the video on this, but we're going to spend a minute here saying this is rather strange. So you have multiple things going on. First off, let's just get to the easy one. You have XBB116 entering the picture. Okay. That shouldn't cause someone to leave. Haha. Then you have the CDC's pandemic emergency ending. Okay. Then you have the World Health Organization pandemic ending today. But to top it off, you just had this big outbreak at a CDC meeting. So somewhere within all this could potentially be a reason why she's leaving. We don't know the true legitimate reason. There's some people also speculating, and I've seen this quite often posted. She did have coronavirus. Does she have long COVID? I don't know whether she does or not, but I find it very strange that she is stepping down right at the same time CDC's had an outbreak, CDC's ending a pandemic emergency, or White House, the White House is ending it. The World Health Organization's ending the emergency. New variants coming. It's just all at once. Now, I have heard rumblings about the person who's going to take over is a much better candidate for the job. I hope that's the case. But yeah, Rochelle Lewinsky, whether you liked her or not, I know everyone has their own different opinions about how she handled things. She is stepping down from the Centers for Disease Control. If you even want to call it that, because if they control disease, I wouldn't be here having this discussion with you about coronavirus. Alright, remember Drake University outbreak? There were 76 cases as of, I believe, Wednesday. Well, we actually have an update on that. As of yesterday morning, it was up to 153 cases, so it more than doubled in one day. That's really bad. Does anyone remember? I posted a Who Remembers last night on Twitter. Who remembers the Cornell outbreak in Western New York? It happened at Omicron BA.1. This sure reminds me of that outbreak, that BA.1 Cornell outbreak, because look what's happened here. It's 153 as of yesterday. Didn't see an update for today. My guess is it's probably well over 200 now. If not, maybe even over 300 at this point. Because the fact it doubled that fast, who's to say it didn't double again? And remember, there were 40,000 spectators, 5,000 athletes present at this. Now they're saying a year ago they had a surge as well where there were 258 reported cases. Okay, but today, as of what we know today, 153 with less testing. So chances are it probably is over 258 cases, if you get what I'm saying here. All right, moving on to our next kind of a big story. U.S. death rate falls as COVID slips the fourth most common cause of death. Yeah, it may have fell last year, but let's look at it this way. Like I always like to say, did it happen before COVID? And guess what? COVID-19 was, says here, 186.7 thousand deaths or underlying causes of deaths here in 2022. And we know the death total is actually much, much higher than that. The point I'm trying to make here is these are 186.7 thousand deaths that potentially would have not occurred if the pandemic did not exist. Would some of them have died anyhow? Yes, there's a few that would have, but a large number of these people would not have died, and this does not include deaths by long COVID either. So guess what? This is on top of all the other causes of deaths that are going on out there. It's sad to see that there are still this many deaths. All right, finally, we come to this. I added this at about 10:23 this morning, and wow, did it get a lot of responses. I put raise your hand or hit like if you think COVID is still a global health emergency-pandemic. So far, 1,628 people hit the like button saying, yes, it is. And we're going to check in with this again tomorrow. We'll see how high it goes. This is telling me a large number of people, and this is only on Twitter, a large number of people still feel it really is an emergency. And you have to understand, this is in the days of Elon Musk Twitter. Now, I'm a verified Twitter account, but what I mean by in the days of Elon Musk Twitter is they sometimes suppress the word COVID. Imagine how many would have hit like or raised their hand if they weren't suppressing that. Yeah. So, yes, a large number of people still think coronavirus is still a pandemic emergency. All right, moving on to this day in COVID history. On May 5th of 2022, at the time, the WHO, World Health Organization, estimated that there have been approximately 15 million direct or indirect deaths, also called excess mortality, globally from January 2020 to December 2021 that were caused by the COVID-19 pandemic. Southeast Asia, Europe, and Americas accounted for 84% of the excess deaths. That was then. I think that number now is probably over 20 million, but I don't know. There's no accurate count really in the world. Some countries are not accurately posting deaths, and as you see when we do our international reports at the end of these videos, some countries are not even reporting their deaths. So that is such a problem. Alright, moving on to this. Some surprising news today. And that is, look at nationally wastewater. Remember we started seeing that little bit of a rise? It's leveled off again. And even the green region, which is the west coast, look at that. It's dropping even further. So I'm literally surprised here. I was not expecting this to happen. I thought we would start seeing our XBB 116 surge. But it's not starting yet. Taking a look at the wastewater national map on CDC. We'll probably do an update on this over the weekend. Unfortunately, New York State has not come back yet. But one place did come back. Iowa. So we actually have some Iowa data here. So maybe tomorrow or Sunday, we will do an actual wastewater update video. CDC transmission map. Let's refresh this just to make sure that it is the correct numbers, and it is. High transmission, 557. Substantial, 354. Moderate, 1,437. Low, 775. Low transmission is on the increase. That's good. That means that the number of high, substantial, or moderate counties is dropped. CDC variant proportions, we do have an update on that down below. It's the video just before this one. XBB.1.5 is still in charge at 66.9%. XBB.1.16 is at 12.5%. Then this week, XBB.2.3 did get added and it's at 2.7%. Taking a look at the latest update from BNO. This is from yesterday. New cases, there were 27,539. Averages 11,819. That's down by 358. States reporting yesterday, 21 out of 50. In the hospital, 12,850. That actually went up slightly by 48. In the ICU, that's down 1,682. That's down by 6. New deaths, 417. The average is 225. Deaths are up by 8 in terms of the average. And we've been watching. Deaths have not really been dropping this week. They've been level to even ever so slightly rising. So that's a tad bit concerning because you don't really expect to see that with the wastewater being so leveled now. New Jersey, 182 new cases, 64 probable cases. Hospital reported deaths in the last 24 hours. There's 2. How about the hospital situation there? Well, let's see what that's doing. 180 hospitalizations, 10 people on ventilators. In the ICU, we have 23 patients. All right, Center County, Pennsylvania, the only hospital in Center County, Pennsylvania, Mount Airy Medical Center. They have just 2 people in the hospital now. That's fantastic news, and we looked at some capacities in Pennsylvania yesterday, and I actually did not show on camera, but their bed capacity is not doing too bad in Center County right now. That's something I haven't been able to say in some time. New York State, 520 new cases added. 7-day positivity is 1.5%. 24-hour positivity is 1.7%, which is higher than that 7-day positivity. Hospitalizations in New York State, 595. That's down. That's good. Patients in the ICU, 63. That is down as well. Quickly taking a look at some international data. South Korea cases are up by 16%. Deaths are down by 12%. Japan cases up by 9%. Deaths down by 4%. France cases are down 24%. Deaths are down 16%. Brazil cases down 33%. Deaths down 18%. Indonesia, now an 84% increase in cases, 191% increase in deaths. Vietnam, 23% decrease in cases. Deaths are just at 7 this week compared to 2 last week. And finally, the Philippines, 82% increase in cases, and they have not reported deaths. Maybe they've had no deaths. I honestly don't know. And now for this week's flu update, which should be in. Yep, it is in. So we are watching here moderate levels of flu now in New Mexico. That's a little concerning. We also have moderate levels of flu in New York City, and we continue to see high levels of flu in Puerto Rico. I'm having a hard time understanding why it's high in Puerto Rico. My one theory is, and someone correct me if I'm wrong, coronavirus tends to damage our immunity. And Puerto Rico had a long rotation. It was like a 6-month period wave last year of coronavirus. A lot of people got infected there. So I'm thinking maybe a lot of people have damaged immunity, and it's allowing for flu to spread easier than it used to spread in Puerto Rico. That's just my theory. The rest of the country is not doing bad. The only places that are even close to moderate would be Texas and California. And again, the rest of the country is not doing bad at all. Alrighty, folks, that does it for today's pandemic update video. We'll have another pandemic update again tomorrow. If you like this video, give it a thumbs up. If you're new to my channel and want to see more content like this, subscribe to my channel down below. You won't be disappointed. I'll be keeping you safe long after the emergencies have ended. We're continuing this as long as there's news and data in relation to the pandemic, which will be a long time to come. Have a great afternoon, everyone, and have a great weekend. Stay safe.